v-am regăsit, doamnelor, domnilor, aici la Sănătatea Fără Frontiere. Astăzi stăm de vorbă cu domnul doctor Melih Akin. Domnia sa este chirurg pediatric în cadrul Göztepe Medical Park Hospital din Istanbul. Hello, doctor. Can you hear me?
Hello, yes, we can hear you.
Nice to see you. Nice to talk to you. Doctor, I would like to start our interview by asking you, do live tumors occur to children and how are they treated?
Çocuk hastalarda tümör konusunda, ya çocuk hastalarda karaciğer tümör konusunda.
Çocuklarda karaciğer tümörü, hepatoblastom, en çok hepatoblastom olarak ve 1 yaş altında görüyoruz. Genelde 5 yaşı sıklığına kadar görülebiliyor. Çok sık görülen tümörler değil. 100 binde 1-5 oranında görülen tümörler.
Normally, liver tumors occur in children, and also the most common is
Most common type is hepatoblastoma. Actually, these are rarely common tumors. Of course, it's a good thing for kids. 4 and 5 per 100,000 kids. And the most common terms hepatoblastoma under 1 age is common for this kind of tumors. Of course, 95% hepatoblastomas were seen under 5 years age. This most malignant tumors, actually, we can treat and we can resect this kind of tumors. We have learned many things from liver transplantation in Turkey, and actually we have good results about this our information, and nearly 35% to 95% successful rate we have. This is good result is according to English literature in Turkey, in the world, and we have good results. Yep. Another question?
Okay, doctor, please tell us how do you treat benign tumors or cysts in the liver, pancreas, biliary tract to children?
Like malignant tumors, sometimes we should resect the serum tumors in children. Unfortunately, some mass look like a malignant view in computed tomography and MRI. Sometimes we need resection, and some lesions are the borderline lesion. Of course, they need to be resected by us and my team. Actually, and focal nodular hyperplasia and adenoma and other, for example, big hemangiomas are needed resection sometimes. And depending our information and our knowledge, we can resect these tumors successfully. Of course, they are. I'm talking about the liver resection. It's hard and difficult operations, and sometimes it can betray the patient's health. But generally, we can force our limits for resection. Sometimes we can prepare this patient's family as a donor. After that, we can do this kind of operations.
Dr. Melih Akin, please inform our viewers, do newborn patients with prolonged jaundice need surgical intervention?
Thank you for a good question. Actually, in newborn period, we have to emphasize this topic. Actually, if this patient has extended jaundice, we have to think and we have to know this whether these patients have biliary atresia. It's of course it's not more common disease like other hepatobiliary disease, but it's most important patients for these kids. It can be treated, and it's under 2 years, 2 months ago. We have to operate these kids before 2 months ago because otherwise this operation cannot be successful unless you perform this operation according to rules because it can affect this newborn liver. We have to diagnose this kind of disease under 2 months, and we have to operate these patients. And this patient's needs liver transplantation on his life. We have to know this disease, and we have to operate these patients under 2 months ago.
Thank you very much for this answer. And my next question, doctor, is surgical treatment possible for patients with portal hypertension or with bloody vomiting symptoms?
Yeah, portal hypertension is most severe disease in patients like other liver disease. Actually, we can define these patients bloody vomiting. After bloody vomiting, maybe as a first symptom. This so serious disease, it depends on the thrombosis on the portal vein. Portal vein is collect blood from the liver, spleen, and pancreas and colon. Carry on to liver. If there will happen any thrombosis in the portal vein, it means portal hypertension disease, and the main symptom of the portal hypertension of esophagus bleeding is so serious. Symptom and so serious disease. We have to understand these patients whether this portal hypertension are available or not. After that, this patient needs first of all, of course, endoscopic treatment of the varus, and secondary, they need operation. During operation, we are performing that the anastomosis from splenic vein to renal vein, and secondary, we are carrying internal jugular vein from neck to liver and superior mesenteric vein. Of course, it's heart disease, but extreme heart operation. But after that, it can be created for the portal hypertension because during portal hypertension, if patient have any bleeding, vomiting, it can be treated this patient's life nearly 30%. It's so serious. One attack, 30% death is so high rate, unfortunately. We have to treat these patients if it's suitable, and these patients, the vessels are open. especially splenic and renal vein are open, we have to do operation, and it can be curative, and it can be protective from portal hypertension bleeding.
Okay, before my next question, I will ask my colleague to show us some images with different diagnoses to children. And doctor, I would like to know what are the common tumors when we talk about children, and how are they treated? Please tell us.
Which tumor? I couldn't understand exactly.
What are the common tumors when we talk about children, doctor, and how are they treated?
Under 5 years, especially under 1 year, we show the hepatoblastoma in patients. First of all, these patients generally should be given chemotherapy. After that, they need resection, and generally we have to force the resection in these kids. And resection can be curative for these patients. Especially I saw this image on the video. It's about the cirrhotic liver. We have to protect these patients, this cirrhotic phase in kids, for kids.
I understand. And my last question, doctor, is laparoscopic surgery possible for gastroesophageal reflux?
Of course. Minimally invasive surgery developed in the world and so common. Actually, we use minimal invasive surgery for liver, and additionally, we are using these methods for the gastroesophageal reflux and liver resection and liver cholangiography. We are using this method commonly. We have good and successful results for these patients, and minimal invasive surgery are so beneficial for these patients, especially gastroesophageal reflux and other intra-abdominal surgical disease. After that, we have good results, and correction time and to be healthy time is so good and so close for these patients. We are thinking the minimal invasive surgery of the part of the surgery, not only one method. We are using commonly minimal invasive surgery, laparoscopy, and if the patient needs thoracoscopy, of course, we are using.
Thank you very much, Dr. Melih Akin, for all this information, and hope to talk to you again. Have a nice day.
Thank you. Have a nice day to you. And thanks for...
Doamnelor, domnilor, a fost așadar domnul dr. Melih Akin. Domnia sa este chirurg pediatric în cadrul Göztepe Medical Park Hospital din Istanbul. Am vorbit așadar despre afecțiuni destul de grave în ceea ce privește copiii, care sunt cauzele, simptomele și posibilitățile de tratament ale afecțiunilor despre care domnul dr. Melih Akin ne-a vorbit, v-a vorbit în această după-amiază. Eu vă mulțumesc că ne-ați fost alături și ne revedem data viitoare cu un alt medic de top din Turcia. Toate bune, la revedere!